Hey, can you see me?
Yeah, can you see me? Someone walked right through me back there.
We might be dead. Are we ghosts?
How could I have done something like this to myself? What was I thinking?
I know, I was thinking I could have done something different too.
I wish I could have talked to somebody.
I think there are places that we could have went.
Can you show me?
Sure.
The ghosts travel further. Will we see more of the ghosts?
Yeah, we were able to use the concept of the ghost to do a bit of a walkabout to key services. And so they've gone on this journey and they actually become the eyes of the viewer.
This is AVR, AIDS Vancouver Island. It's one of the other places we could have come for help.
Well, let's go take a look. Hi there.
Hi. I need to get some harm reduction equipment and perhaps an naloxone kit.
Yeah, I can see if he's available.
Welcome everyone to Where We All Belong. Today we'll be interviewing Sarah Sullivan of AIDS Vancouver Island for Campbell River and Comox Valley. Sarah is also a member of a long-standing member of the Drug Strategy Committee, and so we're going to have a conversation today about harm reduction. And in other communities, that if you're not living in the Comox Valley and you're watching this, most communities on the island have their own versions of harm reduction services. So this is specific for the valley, but you can look for those in your own community as well. So Sarah, good morning.
Good morning.
So who is your service for, and how would they access it?
Well, our services at AIDS Vancouver Island are for people who are HIV positive, hepatitis C positive, or those who are at risk of contracting those diseases. And people can access our services through our office on 6th Street in Courtenay at 355 6th Street. And it's just a drop-in service. People don't have to have appointments. They can phone and make an appointment, but they can just drop in as well. We also offer comprehensive harm reduction services to people who are using illicit drugs. So that can be any materials for injecting drugs, as well as smoking crack cocaine or crystal meth. So those are the folks that we serve.
And can people drop off their used needles at your service?
Yes, they can. So they can access clean supplies, as well as bring in any used supplies, and we have containers that they can take home or bring things back in, and it's a safe disposal site as well.
Okay. So what happens, you've talked about it a little bit already, so what happens at AVI? I think that's the initials that people use commonly in the community. So what types of things?
Well, we have, people can access my services. I'm a registered social worker, and I'm also the positive wellness counselor in the Courtenay office. And they can come and see me for support and education and advocacy services, short-term counseling if they are Hep C positive or HIV positive, as well as we provide community-based education about HIV, hepatitis C, safer substance use, and safer sexuality. We also have a youth outreach worker who works in schools and community organizations. And then they can come in for the harm reduction services. And we have a full-time harm reduction worker who can help them learn about safer substance use and safer sexuality. Anyone in the public can also come in and get free condoms, and those are accessible just in our main foyer as well. So you don't have to come in and ask anybody, you can just come in and help yourself. And so people drop in from 9 to 4, Monday to Friday. Fridays is 11 to 3, just through the rear entrance. And that's another thing is that we have a front entrance and a back entrance through the alley. So a lot of people, especially in small communities, are not that open about their substance use, and they can come in and it's very discreet and ring the doorbell and come in and get their supplies. And when they get their supplies, it's not just like a vending machine. We're also there to help them with other struggles they might be having. So if they need somebody to talk to, we're there. We have education and resources for them to help them with what's going on in their lives. So it's a good, safe space for people to come and access support.
Is there a cost for these services?
No, it's absolutely free. The provincial government funds through the BC Centre of Disease Control all the safer substance use materials that we access, so they're shipped to us and we can provide them to people free of charge. And the other thing we do as well is we provide overdose prevention training. So anyone who is using opioids is at risk of overdose. And so we do one-to-one and group education as well.
That's good. There's been an awful lot, an increase in overdoses from fentanyl and derivatives lately. Is there any place else that harm reduction supplies are available in the community that you are aware of?
Yes, we have a partnership with the Caravan. They are Monday and Wednesday evenings and Friday afternoons, and they have a regular route that they travel, and they get supplies from us, and they provide those to people who access their services. So they are a secondary distributor of the safer substance using supplies. And the other place in the Comox Valley that people can access supplies is in the afternoons at the England location of mental health and substance use.
Okay. So if somebody wants to stop or change how they're using illicit drugs, how do you handle that? I mean, you know, as you say, there's a person there, sometimes connections get made and people might ask that question. What would you say?
That's right. So that is a big part of harm reduction. Harm reduction is a continuum. It is, and it's based on a philosophy of meeting people where they're at. And so if someone comes to talk to us and they want to change their drug using behavior in some way, we base it on a strength-based model and ask them, well, have you tried any different things in the past? What's worked? What hasn't worked? Because as we know, often with substance use, there's cycles, and people can change from using heavily to maybe having periods of abstinence and going back and forth. And so the first question is asking the individual, what's worked for you? And also having the space, giving the person space to have a real frank conversation about what does the substance use do for you in your life? Right. And what are the challenges that it's presenting? And so really taking that time to look at it from that basis, and then say, okay, so what would you like to change? And what would that look like? So for some people, that would be maybe changing the way they consume that drug. So going from injecting to possibly smoking it. So we can give information about that. Or it might be changing their drug. They may be a poly-substance user, and maybe one drug is causing more issues than other ones. So maybe changing that one. And brainstorming with the person about what strategies they would like to try. There might be other resources that they would like to connect to. So for someone who's using opioids, for example, they may be interested in doing an opioid replacement program such as methadone or Suboxone. So we can help them make those phone calls, help them make appointments, as well as a plan of how to get through until they have that appointment. They might be interested in going into a detox program, so we can help them connect with withdrawal management services in the community. They also might be interested in treatment, so we can connect them up with the outpatient substance use services in the Comox Valley. So it really depends on what the person's goals are and what they want to do, and then we support them in that way. And we accept that they are the experts on their own lives, and that there is no agenda. We are there to meet their needs as much as we can for as long as they need, and we accept them just the way they are.
So you talked about connecting people with other services and meeting them where they are. There's a lot of people who have serious substance use problems, and they also have trouble with housing. Do you do any kind of support or information or things like that around that? It's a big issue in our community, in many communities. Yeah.
So we do a lot of supporting with people with meeting their basic needs, and so we can support them in a few different ways. We can help them access financial supports if they need to get on to income assistance or employment insurance. We can help them access databases locally for housing, but often people need some more one-to-one ongoing support. And so there are a few places in the community that do offer that. We are very fortunate in the Comox Valley to have some really creative strategies. So there's homeless outreach workers at the Wache Friendship Center, and then we also really work closely with the new team, the intensive case management team through Island Health, who we refer to, and then we often work collaboratively to support people who are using substances and who are homeless or at risk of homelessness. So it's a really an interdisciplinary and multi-agency approach of supporting that person, and it's led by what they want.
So why do you think your service works?
I think the service works because we do truly embrace people and accept them where they're at. So they don't have to pretend to be something that they're not. And people who use substances are from all different walks of life. And people can feel safe to come in. It's confidential. Even to access harm reduction supplies, they don't even have to give their name. We have a database just to keep statistics for how many things we're giving out and how many we get back, but it doesn't have anything to do with their name, so it's completely confidential. And we accept people, and and it's not just accepting, we actually sincerely like and care about them. And we enjoy the time that they're in our office. Often people come and they're struggling, but they're often also there to share some happy moments. And we also offer a coffee in the mornings and a light breakfast. We have some local bakery, Grains Bakery donates bread, and people can have some toast and coffee in the morning. And we have education in the morning, and we have healthcare services as well. So people can access a nurse and a nurse practitioner and have short health education and peer support.
So is there anything else that you would like to say about AIDS Vancouver Island services? You've talked about so many things that you can offer people that often don't have, much in their lives and maybe don't feel that much hope. But I'm just wondering, is there anything that you haven't mentioned that you'd like to? Any milestones or anything like that? Or
Well, we are a nonprofit that's been just celebrated its 30th anniversary. Wow. And we have offices all up and down the island. So that's another piece, is that people can move around the island and have comprehensive support. So we have offices in Nanaimo, Victoria, and Campbell River. And that one of the things I'm most proud of is that we work very well with other agencies. And so in these times of limited resources, we can support our folks best by working collaboratively with other people, as much as people want that, of course. But it's in a small community, we often need creative solutions, and we really are good at that at AIDS Vancouver Island.
Yeah, I'm aware of that. So thank you for all that you do, and I'm so glad we have your service in the community. It really sounds like for people who are really thinking about, needing to talk to somebody and really wanting to find more health for themselves, that you're a great service for them to connect with. So thank you very much.
You're welcome.
For taking the time today.
Thanks for having me.
Okay. Today we have Mark with us as a guest. Mark has used the services of AIDS Vancouver Island, and he's here to talk with us. So Mark, what do you want people to know about harm reduction?
Well, in my case, harm reduction has helped me a great deal. Like I'm one of the lucky few that because of harm reduction, I haven't had any life-threatening diseases. I've always been pretty safe. I'm a father of 4 children and stuff, and I'm really concerned. I can't keep paraphernalia around my house. I wouldn't want to. So it's, I have to have access to things on a daily basis. I use injection drugs, so that's always available to me. The harm reduction program here is excellent. The people that run it are very nice. AVI is a place that we can go and you can feel safe there. And, they worry about everybody. There's nurses there that come and help people out. I've seen people go in with abscesses and just life problems. Like, I know people that come in and they just vent. And I mean, that is a help in itself, right? But having the access to the paraphernalia and stuff that you need is really important. I mean, you're looking at the rise in hepatitis C and, all the hepatitises and AIDS and everything else. And I mean, this has put quite a dent in that, I'm sure. I don't know any of the statistics or anything. They do a very good job here. I mean, the community really owes them kudos, and everybody else does too. I don't think they're appreciated enough, for one thing. But yeah, I thank them all the time. I would like to see a little bit more of a program on the weekends, but yeah.
Today we're going to be talking with Jen Block, who's a nurse with Positive Wellness North Island, and she's going to be telling us a little bit about that service. So welcome, Jen.
Hi, thanks for having me.
So who is the Positive Wellness North Island program for, and how would they access it?
Positive Wellness North Island is the name of our North Island regional service for people who have viral hepatitis and HIV. We cover the North Island, so Fanny Bay North. We have head office in Campbell River. I have an office here in the Comox Valley. We have nurse practitioners, registered nurses like myself. We have office admin staff. We have mental health workers that all work as a team to support people who are positive, mostly for Hep C and HIV, and who are at risk to acquire those viruses. So it is for people who are at risk of acquiring and who have viral hepatitis and HIV. Yeah. Thanks. You can access our services through a physician. You can ask for a referral, you can call us and refer yourself, or you can be referred by another agency. It's really, we try to make ourselves easy to access. We have outreach to different places and meet people in all kinds of different settings as well. Yeah.
So what happens when someone accesses your services? What do you offer?
Yeah, so it really depends on what the person's coming for. We do assessments, we work with specialists to look at treatment, we do education, support, we help people connect to appropriate services, and that can be different things for different people. It just really depends on the individual who's coming to see us. Yeah.
So what are the hours that your service is open, and also is there a cost for them to access that?
No, so we're an island health service. There's no cost to access our program. We are working in collaboration with AIDS Vancouver Island, so you can access us through AVI, and our service is generally Monday to Friday, 8:30 to 4:30 is when you'd be able to talk to somebody. Yeah.
Mm-hmm. So this series is called Where We All Belong. How would the Positive Wellness North Island program fit into that theme, or does it?
So I know this series is about substance use services in the Comox Valley, and we're not specifically a substance use service. Like I said, we're sort of more disease focused. However, lots of the folks that we work with are either current or past substance users, and we do a lot of work with people who may not be connected to traditional substance use services, and so we work with folks maybe even before they're interested in looking at their substance use or at different points along that continuum.
So why do you think your service works?
Well, I think that the people to ask if the service works are the people that come to see us, but I can tell you that we're friendly, we are fairly easy to access, and we are really interested in working with people on what is most important to them. And so I think one of the real positive aspects of our service is that, you know, you don't have to meet a lot of different criteria to access us. And if we aren't the best fit for the person who's coming to see us, we'll really work with that person to make sure that they are connected in the way that works best for them to even a different service.
Thank you.
Yeah.
So in the time we have left, is there anything else that you'd like to tell us about the Positive Wellness North Island services?
Yeah, so it's really important to know that we offer HIV testing. We offer services with our local specialists to treat and cure hepatitis C. We work with your family doctor and nurse practitioner to make sure that you're getting a great workup. And that I think it's really important to know that you know, if you've never been tested for hepatitis C, that would be a good idea to have that test done with your family doctor, and that there are treatments available for Hep C that you can be cured, and there's new treatment, yeah, that is really different than what we were able to offer before, and that there's really good medication for treating HIV as well. So I think it's really important for people to remember that although there's lots of stigma still associated with hepatitis C and HIV, there's really good treatments, and that there's great supports in this community to support people who are positive.
So Jen, if you were to describe a compassionate community, what would that look like?
I think a compassionate community is a community that has a place for everybody, regardless of who that person is or what they happen to be doing. That there's a place for people to have a home, that there's a place for them to contribute, to have a job, to be a part of the community.
Could I just ask you to let us know what the phone number is and then the address, so that any of our viewers that are, you know, maybe want to find out more information, they can have that. So get your pen and pencil or pen and paper.
So our head office in Campbell River's number is 250-850-2605. And locally, my office is at the Comox Valley Nursing Center, which is at 615 10th Street. And the phone number there is 250-331-8502. I'd be happy to talk to anyone who wants to give me a call. Yeah.
Okay. Thank you.
Thanks for having me.
So Sarah, how would you describe a compassionate community? What would that look like to you?
A compassionate community to me is one where everyone is treated with respect and dignity, and that includes all members of society, even if they have a disease or they use drugs. And in a compassionate community, everyone deserves and can access food and housing and health care and love and support.